Coronary circulation. Coronary circulation is the blood supply of the heart. Left and right coronary arteries arise from the sinuses of Valsalva at the aortic root. The left main coronary artery divides into left anterior descending and left circumflex coronary arteries. Left anterior descending coronary artery courses down in the anterior interventricular groove and gives rise to septal branches to the interventricular septum and diagonal branches to the lateral wall of the left ventricle. Left circumflex coronary artery runs in the atrioventricular groove and gives off obtuse marginal branches to the left ventricle. This picture is a coronary angiogram obtained by injecting a contrast dye into the left coronary artery using a small tube known as a catheter, which is introduced either through the femoral artery or the radial artery. You can see the left main coronary artery dividing into the circumflex and left anterior descending branches. Left anterior descending branch gives rise to diagonal and septal branches. The right coronary artery runs in the atrioventricular groove and gives off the sinus node artery and right ventricular branches. At the junction of the interatrial, atrioventricular and interventricular grooves, known as the crux of the heart, it divides into posterior descending artery and posterior left ventricular branches. The posterior descending artery runs in the posterior interventricular groove and supplies the posterior one-third of the interventricular septum. If the right coronary artery crosses the crux of the heart, it is called a right dominant system. If it is the left circumflex which crosses to the opposite side, then it is called the left dominant system. PDA and PLV branches arise from the left circumflex in a left dominant system. In co-dominant system, PLV comes from the left circumflex and PDA comes from the RCA. AV nodal artery usually arises from the right coronary artery. In both left dominant system and right dominant system, major portion of the left ventricular myocardium is always supplied by the left coronary artery. This is the right coronary angiogram and it shows right ventricular branches, posterior left ventricular branches and posterior descending coronary artery. This picture is also obtained by injecting contrast dye into the right coronary artery through a small tube known as a catheter. Important coronary veins are the lateral veins, great cardiac veins, anterior interventricular vein, oblique vein of Marshall is also known as the oblique vein of the left atrium. Cardiac veins drain into the coronary sinus and coronary sinus in turn empties into the right atrium. Thebaceous veins are veins which can empty directly into the cardiac chambers. Most of them drain into the right atrium. Least number connect to the left ventricle. Thebaceous veins draining into the left-sided cardiac chambers cause a small right to left shunt of deoxygenated blood. Please subscribe to this channel for future updates.